Hello everyone, a very warm greeting of the day. My name is Aisang Limbu, and today we are going to talk about spinal deformities. So, what is spinal deformity? The spinal deformities is the misalignment of our spine, and there are three types of spinal deformities. First one is kyphosis, second one is lordosis, and third one is scoliosis. And we are going to talk about every type of spinal deformities in this video. So, first type is kyphosis. So what is kyphosis? Kyphosis is the backward bending of our upper spine, to be precise, our thoracic and cervical region. And the main cause of kyphosis could be from our birth or it could be from the bad posture during our childhood or in our teenage. Or it could be from lifting heavy weights during our early childhood. And for better understanding, we'll be referring to the X-ray of kyphosis, and we all know that the X-rays actually the X-rays actually help physicists to make it to understand better. And so here we go. As you can see in this image, this is the lateral view of this is the lateral view of our upper spine. So as as we can see, there is the bump in the back, which making. So sorry for the technical issue. So we'll be referring to the axis of kyphosis, and uh, here is the axis of kyphosis. So as we can see, our upper our upper spine has tilted backward, making it humpback and making the making the life of the patient even worse. It could shorten the lifespan of the patient, and it will make the one suffering from this miserable. And the and the next type is lordosis. So lordosis is the forward curvature of our lower spine, especially our lumbar region. The the lordosis can cause by it could be caused by by birth or by aging or by the bad posture, or it could be from osteoporosis. So we will be referring to our x-rays for better understanding of this video. So here is so so the image is like this. As we can see, this is the lateral view of our lower spine, especially our lumbar region. As you can see, the lumbar region has tilted forward, making it backward curvature of 60 degrees. So, and the and the last type is and the last type is scoliosis. The scoliosis here is of them all. It makes our spine S-shaped, and and its main cause of scoliosis could be some type of illness. So, so the main cause of scoliosis could be some types of diseases. So, for better understanding, we'll be referring to the to our expert video, and we all know that scoliosis can be of different types and of different languages. So,
This is a X-ray of a boy of 18 years old who has got a dorsolumbar scoliosis. The main curve is the dorsal curve and the compensatory curves are the proximal thoracic and the lumbar curves. The Cobb's angle in this case is 71 degrees. We operated this boy 1 month ago and you can see the correction in the scoliosis. So this 71-degree curve is corrected to almost 9-degree curve, and there is a complete correction of the scoliosis which is seen. So how the bend was there before, you can see here, and now you can see after correction this curve has completely corrected. So we'll just show you here that how the curve usually gets corrected. So initially there was a big deformity which was seen on the back, but now after the deformity correction both his shoulders are very well balanced, and you can see the scar is almost nicely healed. Thoda walk some more. You can see the range of motion is also very nicely preserved. Home आगे right side ला वळ, left side ला वळ. So usually people are confused that after a scoliosis correction surgery motion will get restricted, कि हमारा जो मूवमेंट है वो काफी कम हो जाएगा, बॉडी स्टिफ हो जाएगा. बट आई ऑलवेज से दैट मेजोरिटी ऑफ द मूवमेंट इट हैपन्स इन द हिप फ्लेक्शन. जो हम सामने झुकते हैं, पीछे होते हैं, the majority of the movement happens in hip flexion, and even after we do a dorsal spine fixation पेशेंट की मोबिलिटी में उससे बहुत ज्यादा फर्क नहीं पड़ता है. इनफैक्ट वी हैव हैड फ्यू गर्ल्स इन द पास्ट जो इवन आफ्टर स्कोलियोसिस सर्जरी दे डू जिम्नास्टिक्स. सो लोगों में ये जो गलत फहमी है कि स्कोलियोसिस सर्जरी के बाद बैक पूरी स्टिफ हो जाती है, दैट इज अ कंप्लीटली रॉन्ग नोशन. एंड द पेशेंट एंड फैमिली शुड बी अवेयर दैट स्पाइन की जो फ्लेक्सिबिलिटी है that is very nicely preserved, and all the patient's day-to-day activities can very nicely be performed. Thank you.
So, as we saw in this video, the 18-year-old boy has suffered from scoliosis but later get healed. So, now we will be referring to the to the book chapter, so where it has shown that the types of scoliosis according to the age. So there are three types of scoliosis according to the age, that is infant, adolescent, and and the adult. So, so this from the chapter 72 of book human, human spinal deformities. And so so now we'll be watching the we'll be watching the will be the preparation of patient which is being ready for X-ray procedure. So 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 this is the video that I had done with my friend as a patient.
Everyone, so today we are performing X-ray for the diagnosis of scoliosis. So for this, I'd like to call my patient, my colleagues. So please come to the working and lay down. So after lying down or in a supine position, so I will adjust our X-ray tube. So So I will focus the center of our beam to the center of our spine, and I just move the X-ray tube, and then I will perform the X-ray. So thank you.
So what I had actually done in this video is I had prepared my patient for the diagnosis of scoliosis. So in that video, I had prepared my patient for the diagnosis of scoliosis through X-ray. So what I actually done in that video is I prepared my patient by telling her to lie in a supine position and adjusting the X-ray tube for a proper anterior posterior view. And the anterior posterior view is the best for the scoliosis, and for now we'll be referring to the research paper which is which is published in the, the book Human Spinal Deformities. So so this research paper, what it has actually written is that what the research is really about is that only the 7% of the patient which is suffering from scoliosis actually needs the treatment or the surgical treatment because more than 93% of patients could be healed from uh, homo by homeopathic exercises and by with the help of physiotherapies. The maximum number of people don't need the surgical method to cure from this scoliosis. So this all about the types of spinal deformities. So now we are going to talk about spinal deformities as a general. So now we'll be referring to the article referring to the article that is published for the public and anyone can read that. So, so according to the article, it says the in order to capture a proper whole spine lateral view, a 30 centimeter wide and 90 centimeter in length vertical film should be used and should be uniformly 182.88 centimeter away from the subject. Away from what is actually saying that for the proper view of whole spine, we should use the 30 by 90 centimeter X-ray film to capture a whole spine, and it should be in the distance of 182 centimeters from X-ray tube to the film. So as we all know, while performing those scans, it is always the risk of exposing patient too much. So 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 we'll be referring to the book chapter 39 of Human Spinal Deformities, where it has where it has clearly where it has clearly said that while performing such while performing such scans, we should protect the patient properly by giving them thyroid shield, gonad shield, as well as proper collimation for essential for minimizing exposure to the patient. And so, oh, so, so with this, the final step for curing any type of spinal deformities is surgical method. Uh, so now we will be referring to the book chapter 47 of Human Spinal Deformities, where it has clearly mentioned uh, the surgical methods. So we can see in this image that the patient has to lie in a prone position, like in this type of setup, for better enrichment of the spine. And we could use the other materials like sandbags for better helping of the patient. And this is the final steps of curing the spinal deformities. So at last, I like to say that spinal deformities can significantly impact quality of life, but early detection, tailored treatment plans, and ongoing management can lead to improved outcomes. Management involves a combination of lifestyle adjustment, such as maintaining good posture and staying active, and medical intervention ranging from non-surgical options like bracing to surgical correction for several cases. The surgical correction for several cases, the conclusion for while they are a significant challenge, a proactive approach focusing on personalized care and a comprehensive treatment strategies can help minimize their effect and enhance a patient overwhelming well-being and more mobility. So in the end, the spinal deformities is curable and the ones suffering from is suffer a lot and we should respect them. Thank you.